Question. Do you have any advice for new nurses with no experience? Where should I start? So first, I want to say don't lose sight of the fact that you do have clinical experience as a nursing student. So every nursing program requires clinical hours. So you cared for patients, you passed meds, you did skills. So don't lose sight of those things. However, when you're looking for a job, if you can find a new grad kind of residency program, that is ideal because they will pair you with a preceptor. I had a preceptor for about 13 weeks. And then in my new grad program, I also had a lot of classroom education experiences too. And like simulation labs and skills, testing, that type of thing. So they will provide you with more education and more opportunities to learn if you're part of a new grad program. However, in some geographies, getting into a new grad program can be difficult. So if you are flexible and able to move around in the country, there are certain geographies where you are more likely to be able to get into a new grad program than, say, Southern California, where things are extremely competitive. So hopefully that helps.